Mental Health Infrastructure by Spectrum is a design research project that focuses on neighborhood strategies for mental health care. The project begins with questions like, what does mental health infrastructure look like in the future, and how could a street or neighborhood be part of mental health care system, given that psychiatric centers are returning to communities as well as many mental illness now exist along a spectrum, like depression and anxiety, and are more prevalent in urban dwellers. According to WHO, today 1 in 4 people in the world will be affected by mental or neurological disorders at some point in their lives. Around 450 million people currently suffer from such conditions, placing mental disorder among the leading causes of ill health and disability worldwide. Urban contexts with increased environmental stressors and social stressors result in increase in many mental health problems. Despite the increase in mental health issues, there exist obstacles between people who need help and the actual services. Many people are reluctant to seek professional help due to lack of knowledge about mental illness or social stigma associated with them. Though we have urban designers and architects trying to incorporate mental health promoting design in public space, this design tends to overlook social psychology of those living with mental health issues. The objective of this project is to match social context with social psychology of those living with different levels of depression or anxiety. As depression and anxiety exist along a spectrum, people could be a little bit depressed or severely depressed. Social mental health infrastructure design and the sociality on streets and in public they afford. There are 3 design proposals here that range from service to urban design on the design spectrum. The first one is scalable space that affords social interaction of different levels, accommodating different mental states and social needs. People with depression will have the means to take baby steps from social interaction that requires lower commitment and smaller group of interaction to that involves larger group of people and higher engagement. Second proposal is to include more seclusion on open public space so that people with anxiety could find public space more approachable and stop worrying about other people's judgment while taking a walk on the street. Last proposal is to offer alternative and informal therapy to people that emphasize more on empowerment instead of treatment. The outcome would be avoidance of social stigma associated with traditional therapies, as well as acquisition of new interpretation of the struggles one is encountering. The underlying concept is to introduce spectrum of sociality, privacy, and engagement in the infrastructure so that people can break down big goals into smaller actionable tasks that lead them to a desirable level of social connectivities. It might be hard to move from completely private realm to public realm all in a sudden, or to participate in a large community activities while smaller ones is already very intimidating. The design proposal aims to bridge the gap. The method starts from secondary research to investigate trends in mental health infrastructure and services that include mental health promoting cityscape and alternative therapies. Then primary research is conducted to collect anecdotes on forum and interviews to back up or modify the existing proposals. Other theories such as social pedo theory or prospect refuge theory are also looked into to inform design decisions. The resulting urban strategies in neighborhood scale are Alleyway Redesign, street furniture and in pocket space, and park pavilion. Alleyway Redesign starts from the premise of returning once car-dominant street to pedestrians for enhanced street life. For depressed people, if going to gym requires too much energy, taking a walk around the block would be a nice alternative and allow them to regain confidence and energy for bigger activities in the future. Street furniture like Observatory allow pedestrians to find seclusion on open street and sit on outlooking deck from above to take break from a crowded urban setting, while having a chance to take care of greenery. Finally, the park pavilion offers activities of different scales. One can participate in smaller group activities or larger ones, and when they all become overwhelming, they could retreat to individual reading room to recharge and come back again when ready. With this proposed design, people living with depression and anxiety could find mental health promoting public space that meets their needs near their home and take baby steps to leave their private realm toward community engagement and social interaction that have preventative health benefits.